California Food Policy Advocates, also known as CFPA, was founded in 1992 with a goal of preventing hunger among low-income Californians. Originally, CFPA focused its work on preserving and improving the federal nutrition programs, as well as increasing participation in them. The broad reach of these programs and the amazing benefits they provide make them powerful tools to overcome hunger. While we continue to employ some of the same strategies we did 20 years ago, our organizational lens has evolved. We no longer work solely to prevent hunger, but also view the federal nutrition programs as tools to directly improve health and diet-related disease. We're advocating for policy solutions that get younger kids off to a healthy start by improving the nutritional quality of the food that's served in childcare and school settings. We're also working to ensure that all low-income children have access to and are able to participate in the federal meal programs. Ultimately, these efforts will improve student health and academic achievement, setting kids on the path to long-term success and well-being. We're also working to provide policymakers and parents with a tool that tracks progress and performance in improving school nutrition. We're developing a combined measure of improvements to participation, nutritional quality, and appeal in the school meal programs that can be used locally and at the state level to inform policy change. In conjunction with this work, we've developed the Real Eats for Academics and Life, or Real School Food Initiative. This initiative seeks to bring fresh, minimally processed foods back into the cafeteria as a strategy to increase appeal and therefore participation. We want all Californians, regardless of where they live, to have equal access to nutritious food and believe all families accessing benefits via CalFresh should undergo the same enrollment process. We'd like to see health and nutrition programs woven together, both in theory and in practice. Good health depends on good nutrition. As we prioritize the provision of health care for all Americans, federal nutrition benefits should go hand in hand with health benefits like Medicaid. CFPA is one of the few organizations that effectively bridges traditional anti-hunger work and public health efforts to improve nutrition. We introduce innovative policy solutions that both prevent food insecurity and address health across California. In some cases, these policy solutions have become models for national efforts. Through our work on federal nutrition programs, CFPA is uniquely positioned to directly impact millions of low-income Californians, as well as our economy. Improving participation in programs like CalFresh means more low-income Californians receive nutrition benefits, and all residents benefit from the influx of dollars into local and state economies. A relatively small investment in CFPA can help California harness federal dollars and kickstart our struggling economy. Our core strategies include legislative and administrative advocacy, policy-oriented research, promotion and outreach, technical assistance and training, and local, state, and regional partnerships. We leverage each one when deemed most effective and invest in creating the right conditions for policy success. We're tenacious in our efforts to build the perfect storm for policy change, even when this means working toward steady, incremental change. For example, California implemented a finger imaging requirement for CalFresh applicants in 2000. From day one, CFPA fought to eliminate this unnecessarily burdensome requirement. The fight lasted 11 years. We commissioned a state audit of the finger imaging system, introduced several pieces of legislation, lobbied key stakeholders, brought the federal government to the table, and outlined the impact on low-income Californians, using every advocacy tool we knew to rally supporters. In the end, we successfully sponsored AB 6 and ended the finger imaging requirement in early 2012. Not every legislative victory takes an entire decade, but CFPA is prepared for the long haul. We apply our entire arsenal of core strategies to policy issues that'll result in positive change for low-income Californians. CFPA embraces radical incrementalism. By that I mean that one CFPA action alone may be seen as small progress, but taken as a whole, they make for huge changes in the lives of Californians. We measure our success by our ability to change the likelihood of a policy outcome. We consistently position ourselves for a future success. Many of our biggest wins have been stalled or vetoed at some point. We regroup and keep advancing. For example, our first legislative effort to increase access to free, fresh drinking water in California schools was vetoed by the governor, but that proposal has now become a model for federal policy. During our annual legislative planning process, we ask ourselves, is this policy likely to be successful? If the conditions aren't right, we don't chase windmills. Instead, we focus on what needs to happen to make a policy change feasible. We're both passionate about our mission and practical in our approach. We work to prevent food insecurity and improve health among low-income Californians, but we don't provide direct client services. As an advocacy organization, our mission is fulfilled by creating policy changes that improve access to nutritious, affordable food. Much of our success can be attributed to the diversity of our staff, who have backgrounds in social work, public health, law, and nutrition, to name a few fields. The common thread is our desire to advocate. We effectively raise our voices for policy change. Our staff isn't compartmentalized, so it's able to move across the advocacy spectrum. This is key to our effectiveness as an organization. We are most proud of fostering innovative policy solutions to common barriers that Californians face with accessing nutritious, affordable food. CFPA played a key role in the development of the Healthy Purchase Pilot to test the use of incentives to increase the purchase of fruits and vegetables through CalFresh. This work shaped a federal pilot that's being tested in Massachusetts. While the federal pilot isn't happening in California, this isn't a loss. We're hoping the pilot is successful and will make its way back to our state. Direct certification for school meals is another accomplishment. Using technology developed at the state level, we're able to automatically enroll low-income students in free school meals if they also receive CalFresh. Initially, we thought getting water in schools was outside of CFPA's scope, until we recognized the important role that drinking water plays in obesity prevention. Our advocacy and research on water in schools has strongly influenced federal policy, and we're proud to say that that change started in California. One of our biggest challenges is communicating our work to others. We need to be able to effectively communicate how our advocacy work plays a role in people's everyday lives. As an advocacy organization, we sometimes make waves. We work toward broad public support, but can face challenges by taking positions that shake up public opinion or cause a strong media reaction. California is a massive state. This means that policy changes we seek have the potential to affect millions of people. But it also means that we have a limited capacity for providing direct assistance to the communities across our state. We often find ourselves evaluating the best use of our limited resources. Overall, we work towards statewide equity in access to nutritious, affordable food, and we're choosing projects that help us meet these goals. In the area of school food, we want to make policy change more accessible to communities. Nutrition should be less abstract and more real, showing the direct impact for children and families. We're also interested in a fundamental redesign of CalFresh. We want to take a vast step forward in how Californians access benefits. We are looking to seize opportunities that will allow technology to streamline that process. Applicants should only have to tell their story once to receive a package of benefits that includes nutrition and that supports their health and overall well-being. We need to get low-income Californians involved in policy development through surveying, focus group testing, and direct contact. We've seen success in Los Angeles where students were directly involved in the development of school meal menus. We think a similar approach can be applied to all of our work. We also need to increase our communications. We're excellent at working toward policy changes, but face challenges in educating communities and low-income Californians about them. We want to generate discussions about federal, state, and local policies and what they mean on the ground.